cases in Queensland. This is a pandemic. We are part of the global economy and the global world, and thankfully for the last 2 years Queensland has been spared much of this pandemic. But this is a highly infectious strain, and I want Queenslanders to think really carefully over the next month where they go, especially if they haven't had their booster. So the Chief Health Officer, and we listened to the Chief Health Officer's advice, has given us very strong information about what we need to do, and that is wearing our masks indoors. So please do that. If you are elderly and you haven't had your booster, please think seriously about where you are going. Limit the number of large gatherings that you would be attending, because during this time, and we know that we're going to looking at having a peak at the end of January, early February, we really want to minimise the impact that this pandemic is going to have on Queenslanders. So there are 3,685 people getting treatment in home. We have 10 people in ICU, 1 person is ventilated, and today I have to report that tragically 1 person in his late 30s has lost his life. Can I say any death during a pandemic is extremely sad. I think the families will be very upset during this time of year as well. I pass on to the families our deep condolences. This death will be reported to the coroner, but this goes to show that this pandemic can have very serious consequences to anyone. So please, I know it's holidays at the moment and everyone's out there enjoying themselves, but think very carefully about where you're going. Think very carefully about your family, your friends, your interactions, and we'll get through this together if everyone does the right thing. We had 30,806 tests in the last 24 hours. We'll be getting updated vaccine coverage probably tomorrow or the next day from the Commonwealth Government, so we'll update you on that. And in good news, I can also advise that we've been able to secure a stockpile of 18 million rapid antigen tests. This is a big issue for people out there wanting to get rapid antigen tests. I know it's the topic of conversation everywhere I go. So we'll be moving as we get supplies in. We'll be releasing those supplies, but also too we've been speaking with the pharmacies. They're going to be getting more stockpiles in over the coming weeks as well. So we know that there's a big procurement that has happened and it will arrive. So please everyone, continue to keep safe over these holidays. And can I also add that the cyclone has been downgraded to a tropical low, but we are seeing extremely rough weather from really Harvey Bay all the way down to Coolangatta. Now is the time not to go in the surf. Beaches are closed, and please do not put your life at risk or the life of lifesavers having to go out and get you out of the waters. These are dangerous, these are hazardous conditions, and please do not enter the waterways, and especially the beaches that have been closed. They are closed for a reason. So please think very long and hard before breaching any of those guidelines. So I'll hand over to the Chief Health Officer.
So today we have 4,249 new cases to report, which is in line with what we've been expecting. This brings Queensland's total to 23,941, with 20,239 cases currently active. We have 10 people currently in intensive care in Queensland hospitals, but only one of those patients, a man in his 80s who is vaccinated, is currently ventilated in intensive care. I can report that a man in his late 30s with probable COVID-19 died suddenly in his home on the Gold Coast last night. The case will be referred to the coroner. Our thoughts are with his family. There were 30,806 COVID-19 tests conducted yesterday. We know there has been a strain on the testing in Queensland, as there has been in every state of Australia and every country of the world. There has been significant demand on the Gold Coast, and we are increasing our capacity down there in the next day or so. We are also, as the private sector, as the private testers come back from the Christmas break, we're expecting increasing capacity as well across the state. There are 170 people in hospital with COVID-19, and as I've always said, it's very difficult to determine how many of them are actually being treated because of COVID-19, but our figures indicate that about 147 are specifically requiring treatment for COVID-19, and of those 147, 39 cases are unvaccinated, which is disproportionate when you consider that more than 85% of us Queenslanders are in fact vaccinated. State vaccination clinics administered 1,275 doses of vaccine yesterday, but we don't have updated figures from the Commonwealth because of the public holiday yesterday. And I'd like to hand over now to the Deputy Commissioner, please. Thank you.
Morning. With respect to our COVID operations, yesterday at our borders, road borders, we intercepted 27,931 vehicles, turned around 136 and put 4 persons into quarantine. Domestic flights, we processed 10,362 passengers, 16 were refused entry and 11 were placed into quarantine. So the reminder is still there for everyone entering into Queensland. The requirements for our border passes must be met. We will still turn people around, as you have heard. Yesterday we handed out 247 masks, which is still high, but down from the 700 that we'd handed out the day before. And we did issue one on-the-spot fine to a person in Charters Towers who, entering a retail premises, being given the opportunity by police to wear a mask, refused to do so. In hotel quarantine, we still have 2,478 persons in hotel quarantine, including over 2,000 that are international arrivals, and that's across 15 hotels across the state. We inspected 86 businesses with all in compliance, so well done our businesses out there. And in addition to the on-the-spot fine for the mask, we also issued an on-the-spot fine to a female person on the Gold Coast who entered a hospital without vaccination and refused to leave after beginning direction, and that person was fined $1,378 for not abiding with that direction. And we had one further border breach at Rathdowney where the person was fined over $4,000. Thank you.
Thanks. Good morning, everyone. I just thought I'd give you a bit of a weather brief and then obviously we can open up for questions. So as you've heard, it's now tropical cyclone Seth has transitioned into a subtropical low and is currently located over the southern Coral Sea. The system is forecast to adopt a west to northwesterly track approaching the Queensland coast during the first half of this week, and the system is generating increasing seas and swells, which will coincide with an astronomical peak high tides over the next coming couple of days. It is a severe weather system, and you've already heard this, but they're abnormally high tides and also powerful and dangerous surf. I spent a couple of days down the Gold Coast the last 2-3 days, and the beaches were all closed, and still the amount of people in the water was extraordinary, with surf lifesavers constantly driving up and down the beaches to tell people to get out. And immediately, the second they drove past, people were back into the water. We've already had a death of a father yesterday on the Sunshine Coast, 49-year-old man trying to save his son. So can I please ask that you listen to authorities, that when they say the beaches are shut, they are shut. They're not only putting themselves at danger, and as I said, there's already been a death, but other emergency services as well as our surf lifesavers. Thank you.
Just on the, or the chief officer, just on the latest death, do you know if he was vaccinated? And also we heard that he tested negative PCR, then positive for RAT. Can you just explain the timeline?
I don't have that information. I might see if the Chief Health Officer does. Yep.
I don't have any more specific information that I think is appropriate for me to discuss at the moment, given that it's a subject of a coronial inquiry. All I would say very strongly is that it's very, very unusual for a young man to die suddenly from COVID-19. It's a very unusual circumstance. So it needs further investigation exactly what has happened here. The vast, vast majority of people with COVID-19, particularly young people, have mild illness, particularly if they are vaccinated. I do believe this individual was vaccinated, I believe, is the information that I received. So the circumstances are very unusual, and this is not at all what we would typically see with COVID-19 in someone of this age.
Do you know if he called ambulances previously, or what he was dealing with?
Look, I think it's better to wait for the coronial inquest to find out exactly what's happened. Yeah.
Do you think he contracted COVID in the state or interstate?
I don't know that. It's very likely acquired it here. I mean, we have COVID. COVID is very extensive in the Queensland, certainly very extensive on the Gold Coast.
Do you know if it was the Omicron variant or the Delta?
No, we don't have that information. In fact, we don't even have, at this stage, we don't even have confirmation of the diagnosis. I should say that, make that clear. It's still only provisional, based on a rapid antigen test.
Can I ask about booster shot availability? Are there reopening clinics? Is there enough stock on the booster shot?
I'm certainly in the public clinics. We have adequate stock. I can only speak on behalf of the state clinics, but we are regularly updated on supply, and we have adequate stock.
And in relation to elective surgery, how many will be cancelled? When will patients be told, and what sorts of surgery?
This is done. Look, there's planning that's been going on for 2 years on this, and we will change the need for surgery and the allocation and the provision of surgery in accordance with need, in accordance of where the demands are in different areas. At present, the biggest problem we are encountering in hospitals mainly pertains to staff being furloughed because of potential exposures. We certainly are not ceasing Category 1 surgery, and there is a plan for private hospitals to take on more of the load of surgery in the coming weeks and months if required.
And according to pharmacists, some of the walk-in clinics were closed over New Year. Do you know about that, and will they reopen? Is that concerning?
Which clinics were closed?
Pharmacists?
There were quite a number of clinics that were closed over the New Year period, and so we're hoping that in the next few days we will see a big increase in the number of people coming out to get vaccinated. We're particularly keen for people to get that third dose of vaccine, that booster dose.
But will they reopen, and when? The walk-in clinics at the pharmacies?
I can't speak on behalf of the private sector. I can talk about public hospital clinics. There's certainly all of our clinics, most or all of our clinics are opening over this next period, and the number of vaccinations we expect to be delivering will increase substantially in the coming days.
The medical modelling that was done last year had peak of 1,200 cases in August. Have we had any updated modelling, and how many cases should we expect to see a day when we hit that peak later this month?
I mentioned yesterday our models are working on this at the moment. They are presenting something to us, but the problem is the Omicron strain is so different. The information we're working with is very limited, and different countries have had different experiences. So the modelling is very difficult to interpret. All I can say is we can expect very large numbers of cases, and in the majority of cases, the vast majority of cases, the illnesses will be mild, the vast majority. Already it's pretty clear, given what do we have over, we had over 20,000 active cases and only one patient on a ventilator last night. So clearly the vaccine is working. Clearly the modelling from what was done months ago is very different to what we're experiencing at the moment. But the Omicron strain has made this a little bit more difficult because of the rapid rise in the number of cases we're seeing. So we're expecting in the next few weeks very substantial numbers of people to get infected. All of us are going to be exposed in the next few weeks. I think we just have to assume that all of us are going to be exposed.
There's only one place on the Gold Coast that people can get tested today, in Gold Coast University Hospital. Apparently it reached capacity at 7 a.m. this morning, and everyone else was turned away. Is that acceptable?
I know the demand on the Gold Coast has been very high, and it is there. We are actively increasing the capacity as we speak. They're working on that at the moment. The private sector as well has come. One of the issues has been that the private sector has not been doing as much testing over the Christmas period, and that's put a huge demand on the public sector that we didn't have previously. But hopefully in the next few days, as they come on board, the capacity will increase.
Should that have been ramped up earlier?
Well, there's a limit to what we are actually capable of able to do. I mean, we only have so many staff that we have that can available to do these sort of tests. I mean, most of our staff are involved with the clinical care of patients in hospitals, and so most of the staff that work in these clinics have been pulled from somewhere else. So there's only a limit to how much the public system can do.
Dr. Gerard, on Saturday you said the mask mandate, that you could take them off at the office when you sit down, or if you're in the meeting.
Provided you can distance 1.5 metres. That's correct.
But the health order online doesn't say that. Will that be updated to factor in that?
It does not. We were updating orders last night. Up until midnight I was updating these orders. I will have a look at that. Okay. Thank you.
Do you have an update on the number of cases in Cherbourg, Palm Island and Torres Strait today?
Yes. On Palm Island there has been a single case reported, but I'm confident that the Community and Health Services are responding effectively. Palm Island already has a gene expert machine, so they can test themselves, and we're providing additional support to Palm Island in the form of additional testing and additional vaccination because of that one case. But we know that this strain is particularly contagious, and if we have one case, it's very likely to spread very quickly. In terms of Cherbourg, yesterday I understand there were about 90 cases now linked to the cluster. Most of those people are in their 20s and 30s. 2 patients are in Toowoomba Hospital, and I understand one of them is in the intensive care unit but not on a ventilator. There were 135 tests done yesterday at Cherbourg, which was a combination of both PCR and the rapid tests. So over 500 people have been tested in Cherbourg.
Palm Island Council say there are 7 confirmed cases on the island. Is it concerning given the vaccination rate so low, and what's Queensland going to do?
As I said, it's not surprising. It's going to spread there as it has elsewhere. We already have a 7-day-a-week vaccination service on Palm Island. On Saturday, a nurse vaccinator went there, and they were there again yesterday, and they'll be there today and on Wednesday, and Friday. Additional staff will be sent there to do door-to-door vaccinations.
Dr. Gerard,
Yeah.
Dr. Gerard, just in terms of the death again, you said that on the basis that he tested positive rapid antigen. When was that test?
Look, I probably shouldn't talk too much about this because there may be information coming through as we speak. I mean, my information is an hour old. I mean, you seemed to say earlier on that there was a PCR that was positive. I haven't heard this. Oh, okay. Well, I have not heard any more about the case. So the case is before the coroner. It needs further investigation.
Just ask one more question.
Sure.
Is Queensland Health at all looking at what services support he was provided before he died?
Of course we are. That will be all part of the coronial inquest.
Dr. Gerard, just when the Gold Coast Mayor is asking for clarification around how infectious Omicron is compared to flu, what do you have to say to that?
I think his question was, how does I'm reading this in the media, how does this epidemic compare with an influenza epidemic? And it's not a totally illegitimate question, okay, but the first thing to say is the number of cases we will be seeing with Omicron will be vastly greater than that we experience in a typical influenza pandemic, or epidemic, sorry, seasonal epidemic. And so that has a huge impact on the hospitals. This is not influenza. It is more severe. We don't see this number of people getting sick with influenza. In vaccinated people and the Omicron strain, it clearly is not anything like the COVID-19 that we were seeing a year ago prior to vaccination. So how close they are to each other, I guess we need time. We need more time. This is a new virus. We need more time to find out what your likelihood of ending up in hospital is if you have Omicron, if you're vaccinated, if you're not vaccinated. All these data are arriving day by day, and we're getting more and more information day by day. Most of it is pretty good news, most of it, but the big problem is the sheer volume of people that are going to get this virus. That's where the big problem will arise. All of us are going to be exposed in the next few weeks, and even if you had just the 2 doses of the vaccine, that probably isn't enough to stop you from getting infected, even if you have only mild symptoms. That's why it is so critical that people get that 3rd dose of the vaccine, because that is more likely to protect you from getting infected, and certainly even more likely to protect you from getting severe disease. And from tomorrow, anyone who has had their 2nd dose of vaccine more than 4 months ago, from tomorrow, can get a 3rd dose. Okay, so from tomorrow, anyone who has had their vaccine more than 4 months ago can get their 3rd dose. And I would strongly encourage everybody to go out who fits into that criterion to go out and get that 3rd dose, because it clearly is protective. Your antibody levels rise substantially, particularly those older people, those who are more vulnerable, those who are most likely to end up in our intensive care units.
Some of the mayors in remote communities say that they should be prioritised for rapid antigen tests, given comorbidities, under vaccination and overcrowding. Other mayors have called for housing help, because if you've got 7 or 8 people in a house and someone's COVID positive, it's difficult for them to isolate. What's the government doing to help on those 2 fronts?
Well, what the government's doing is telling people to go and get vaccinated. We have given the opportunity for every Queenslander in this state the opportunity to get vaccinated. Now, unfortunately, there has been some negative social media posts going around that have had a negative impact on some of our Indigenous communities. I'm now urging people in those Indigenous communities to ignore those social media posts and immediately go and get your vaccination. Can I also say to Queenslanders, make your New Year's resolution, go and get your booster. It is really important. You've heard what the Chief Health Officer said. Make sure you get your booster shot. It is important to yourself and your family. Next week, our children will have the opportunity to get vaccinated. Make sure you are booking your children in to get vaccinated. It's important that they get vaccinated before school reopens at the end of this month.
During outbreaks from the Northern Territory, the government stepped in and flooded hotel and motel rooms to alleviate some of that overcrowding. Is that being looked at around Sherwood?
If there are reports about overcrowding, I'm happy to speak to the Mayor about that. But I do know that the Mayor has been very active in encouraging her community to get vaccinated. I went there personally myself and encouraged the community to get vaccinated.
Just on rapid antigen testing, we're seeing some of them being sold in pharmacies for double the usual retail price. Are you going to be doing anything to control price gouging?
I can't do anything about price gouging. You have to speak to the federal government about that. But I do know, having spoken to people representing the different pharmacies across Queensland, that they are expecting additional stockpile to come in over the coming weeks. So we are in a pandemic and the stockpiles are getting in as quickly as possible.
Premier, what did you make of the Prime Minister's comments this morning that you can't have rapid tests, sorry, you can't make rapid tests free for everyone?
The only thing I'll say that we've got a National Cabinet meeting on Wednesday, and I'll clarify that, but my understanding was that we were going to be making concessions, especially available to people on healthcare cards and pensioners. So I will get clarification with that on Wednesday. I think it's really important that the most vulnerable members of our community do not have a price impost to go and get a rapid antigen test. Okay?
Once we hit 90%, will unvaccinated people still be required to quarantine and produce the negative rapid test?
I'll have to find that out for you. I have to look at the roadmap. I don't have that on me, Lydia. Yeah. Okay. Okay, just a couple more questions. We might pull it up.
One question about Laidley's to Beale aged care facility locking down because of more than 30 residents and staff testing positive. How did this happen?
That's a question to the federal government because they are responsible for aged care, but we'll also look into that as well. So thank you. Yeah.
Commissioner, can we just ask you one quick question around rapid antigen tests? Have you seen any
Not in Queensland, but I have heard of that. But if there is, look, we'll look into that. That's unacceptable, really. It's an offence, basically, at the end of the day. But if you have any advice, please let us know, because that's completely unacceptable.
Is the plan still to remove police presence on the border once we hit 90% double dose?
So we'll chat about the roadmap in the next week or two, but obviously, you know, other states have done just that. But certainly when we have that further discussion about the 90% mark, that would be a good thing to do. But let's have a chat in the next week or so and see when we get there.
Do you know how many QPS staff have been diagnosed with COVID or isolating, if there's any impact on operations?
So Steve might have the up-to-date figures. Sorry. We do have substantial staff. It was over at 30 at one stage and close to 200 in isolation, but a lot of those have come off. Yes, 72 positive at the moment and 145 in isolation. That changes every day, and a lot of those are from the southeast corner. I am quite comfortable in terms of staffing, though. We do have a very fluid way of doing business. A lot of our commands are stepping up, a lot of the back office is stepping up as well, but certainly, as was indicated, we're in that business where we're in, you know, constant contact with the public, and this is one of the reasons why I made vaccinations mandatory in the organisation, because we knew this scenario was arriving, and sure enough, it has arrived. So can I also reiterate that message about the booster? About a third of my organisation, I think even the numbers are higher just recently because they're not all on the system, have got their booster already. It is incredibly important, and it's the only way that obviously we'll be able to serve the community as we should, because we'll have a lot less people away and more people at work. Thank you.
Thanks, mate. Please take it down, yeah.